my office, and he will be giving an overview on the Department of Housing and Community Development.
Good afternoon, everyone. The proposed fiscal year 2024 budget for the Department of Housing and Community Development totals $33 million, an increase of $15.1 million or 83.9% over the fiscal year 2023 budget. The general fund portion of the budget totals $1.2 million, which is an increase of $165,000 or 15.9%, primarily due to increased personnel expenses. The special fund portion totals $31.8 million and increases by $14.9 million or 88.1%, primarily due to the creation of the $19.3 million Housing Opportunities Fund and 2 new programs for the neighborhood stabilization and conservation. On page 3, the pie chart shows how the proposed funding will be allocated in thousands of dollars. Grants and loans make up almost 85% of spending, due in large part to the $15 million in housing opportunity funds going to the creation of grants. On page 4, some new costs are discussed in the section titled Potential Budget Reductions, as well as expected turnover savings for the department during the current year. However, due to how recently the department was created, this measure may not provide an appropriate prediction of turnover in fiscal year 2024. And in light of these considerations, this analysis does not identify any specific budget reductions. The operating budget highlights section at the bottom of that page analyzes the drivers of the changes within the general and special funds. Personnel expenses, which total $1.1 million and reflect 48.5% of the general fund budget, are detailed. As you can see, 3 new positions have been created recently to provide greater support, increase flexibility of service, and consolidate roles and responsibilities within the department. On pages 6 and 7, the analysis reviews new funding within the special fund for the Housing Opportunity Fund and the Neighborhood Conservation and Stabilization programs and how these programs will function. Pages 8 through 11 review the county's non-community development block grant programs, highlighting new and previously appropriated funding, as well as how many households have been assisted. Page 11 quickly notes how the county has said it will utilize previously appropriated funds from the Office of Budget and Finance ARPA program in fiscal year 24 to support the department's work. And from the bottom of page 11 until page 13, we analyze programs funded by the Community Development Block Grant. While the analysis did not review the fully federal funded housing office, we include a small section at the bottom of page 13 on its fiscal year 2024 budget for informational purposes. And at this time, I'm happy to turn it over for discussion.
Thank you very much. Any questions or comments from the members? Director Hickey?
Thank you, Chairman Jones. Members of the council, good afternoon, everyone. I did want to quickly introduce our leadership team who took the time to join us today. We've got with us Ashley Johnson-Hare, Amira Sadi, Colleen Mahoney, Mary Clay, and Milana Vayner. All big helps on helping put our budget request together for this year. And then if it would please the council, I'm just going to go through a few comments to flesh out what Chris just described from a number standpoint. It is really an honor to be back with you this afternoon to discuss DHCD's FY24 proposed budget. Believe it or not, I've had the pleasure of leading the county's newest agency since it was established and approved by the council 2 years ago. So as a new department, our team remains focused on building and maintaining capacity to address the full continuum of housing challenges that includes homelessness, helping residents maintain their existing housing, building an inventory of affordable units, including accessible homes for people with disabilities, and of course, a wide array of opportunities for home ownership. A key focus area this year, as I've talked to many of you about, is housing stability. That includes the prevention of evictions and foreclosures. I'm proud to say the hard work of our grants management and housing stability teams earned Baltimore County national recognition over the last couple of years, more importantly, while keeping many of our most vulnerable residents in their homes, following an unprecedented global pandemic and economic crisis. Some numbers behind this. Working with dedicated nonprofit partners, DHCD leveraged over $115 million in federal and state COVID funding to prevent more than 8,500 evictions. Behind these statistics are a number of stories of hardworking families who found themselves in crisis through no fault of their own, who we were able to assist. One gentleman in particular was laid off during the pandemic, was unable to collect unemployment due to an error by his previous employer. He found himself struggling with depression as a result of being several months behind on rent. Once we were able to connect him with a rental assistance provider, and with the looming threat of eviction no longer hanging over him, he was able to take steps to address his mental health challenges, secured a job as a food delivery worker, and later began a full-time job at Amazon, allowing him to resume paying his own rent. There are many other stories like this across our county, but still much work to be done. Some good news. The U.S. Treasury recently awarded DHCD an additional $1.15 million in rental assistance. This is funding that had been reallocated from jurisdictions that weren't able to distribute it in a timely manner. These funds were made available to local governments who had demonstrated their ability to effectively and efficiently distribute the funding. I look forward to discussing this supplemental appropriation at the May 30th Council work session. DHCD continues to stay ahead of the curve by investing in a more comprehensive housing stability strategy as our federal funds begin to wind down. DHCD has awarded funding to 5 nonprofit organizations to provide case management and various supports for residents struggling to cover housing costs still. Access to these services is being integrated into our coordinated entry system. Many of you know it is 887-TIME, to ensure that when residents call, they're able to be referred to an organization with the ability and resources to provide services such as financial budgeting, housing navigation, credit repair, job training, landlord mediation, and more. And because housing affordability is linked to stable income, the DHCD team is partnering with DUDE to identify industry partners to connect vulnerable residents with employment opportunities. Our Housing and Economic Mobility Initiative, that we're calling HEMI, uses rental assistance data to map areas with high levels of housing instability and brings employment, training, and educational opportunities directly to the communities where it's needed through DUDE's mobile job centers. To date, we've been able to connect residents with jobs at Amazon, CDL training opportunities, as well as filling a number of vacant county government positions. This work is a reminder of the critical link between housing and economic opportunity. DHCD continues to expand the capacity of its homeless services team, something I've talked to many of you about over the past year. We maintained level funding from HUD, an achievement in and of itself, allowing us to continue supporting 589 supportive housing units. And the agency was recently awarded $7.5 million in new federal funding to provide housing opportunities for extremely vulnerable residents. As many of you are aware, our team is also focused on interagency coordination and constituent services, including the development of a new committee to end veterans homelessness in the county, a collaborative process for coordinating responses to encampments and inquiries about those living unsheltered, improving coordination between DHCD and our colleagues at HHS to enhance Baltimore County's coordinated entry system and expand access to services at our freezing weather shelters. And maybe most importantly, we're out in the community. Most recently, this includes over 30 DHCD-led educational sessions on homelessness, including partners from the police department, EMS, a host of other county agencies, as well as hospital and healthcare entities, the police community relations councils, and faith-based partners. These will continue throughout the new fiscal year, and we're always looking for new places to visit and talk. DHCD's growing capacity around this complex issue recently helped turn a potential crisis into a success story. A supportive housing provider in the county abruptly ceased operations, leaving 15 extremely vulnerable households at risk of returning to homelessness. Our team jumped into action, negotiated reasonable leases, made sure rent and utility payments were up to date, and connected families with food and other resources while a new community-based provider was identified. A few years back, without this team in place, it might not have gone as smoothly for those involved. Home ownership remains a big priority as well. The DHCD budget, as Chris alluded to, includes almost $1 million in combined state and federal funding to promote homeownership in communities experiencing high foreclosure rates by providing up to $20,000 in purchasing assistance for low to moderate income households. Our housing finance team invests in homeownership programs utilizing home and CDBG funding to provide closing cost and down payment assistance to qualified borrowers, in addition to financial literacy and home rehabilitation programs. This past year alone, DHCD funded 30 rehab loans, 20 settlement expense loans, and provided over 1,500 county households with some form of homeownership education and counseling through a cohort of experienced providers. In FY24, we plan to leverage $500,000 in federal home funds to assist at least 22 income-eligible senior homeowners with grants to repair or replace major systems in their homes that have either failed or at imminent danger of failure and may pose a hazard to senior occupants' health or safety. The Office of Housing's Family Self-Sufficiency Program helps Housing Choice Voucher participants achieve economic independence over a 5-year period. The program assisted 8 participants to become first-time homeowners just in the last year, and 11 participants received one of the program's various degrees, certifications, or licenses. As of May 1st, 2023, this program has 214 enrolled participants, and we expect to see many more positive outcomes in FY24. Exciting news, we're also reviving the Live Near Your Work program partnership with LifeBridge Health as yet another innovative vehicle for supporting homeownership and tying it to economic growth. We expect this model to be expanded in the future across the county to allow for the creation of new partnerships with additional Baltimore County employers. Our policy team worked on the county executive's first foundational housing legislative package. With your support, passed earlier this year. Of note, the new Housing Opportunity Fund that Chris mentioned will facilitate investment in high-quality development projects to meet the needs of the county, while the vacant structure designation is already contributing to the creation of a vacant property inventory, ultimately strengthening communities by moving more properties from vacancy to homes. And finally, the agency continues to focus on much-needed housing production. This past year saw approval of the county's first low-income housing tax credit award since 2019. Ridgedale, a unique intergenerational housing community, will soon provide new homes for 80 seniors with 40 townhomes for families. In East Towson, DHCD is supporting efforts to rehab and preserve a historic vacant single-family home to convert it into a 3-bedroom property. The department also provided funding for the rehabilitation and construction of 3 new homeownership opportunities in Turner Station through our partnership with the Eastside CDC. These are both models we expect to replicate countywide in the year ahead. That was a quick snapshot of what DHCD has been working on, the priorities, along with plans for the upcoming year. It really has been an honor to lead this department for the past 2 years. I'm looking forward to a really productive and collaborative FY24. I appreciate the support shown by the council, my colleagues in the past, and I look forward to your partnership moving forward. So this concludes my opening presentation, and I am more than happy to address any questions you may have regarding our proposed budget. Thank you.
Thank you, Director Hickey. And are there any questions or comments from the members?
I have a question, Chair. It's Mike
Yes,
Ertel.
Councilman Ertel?
Yeah, Director Hickey, a couple questions. The vacant list that we're working on, is that something that's going to be shared with each council person by district of where we have these? I mean, because, you know, I have a list of my own. I don't know that we've collaborated, because I can tell you where, or at least houses we believe are vacant because they're not being touched. But, you know, I think it would be good in the long run that we share that information, because we may be able to facilitate moving those houses along as we potentially know where they are.
Yeah, thank you, Councilman Ertel. That, just so you know, so the creation of the inventory is going to be led by PAI, and that's kicking off now that the legislation's formalized. But I couldn't agree more. I mean, sharing this information and, using it to do something around actually addressing these vacant homes was one of the main reasons we pushed it. DHCD's role in this is going to be to do what we can to incentivize the conversion of those identified vacants into some kind of habitable property, either home ownership or rental. So absolutely gotten a lot of calls about this. Look forward to sitting down, looking at lists and talking about this in the coming few months.
Okay. And then the other question I had, there's a lead paint hazard reduction grant. I assume that was from federal government or state or something, and then we're facilitating that. Is that correct? And
yes, sir. That's
what exactly what are we doing there? We have 3 personnel, part-time people that look like they're assigned to that grant or that.
Yep.
Okay.
Yep. That was a grant no, it's okay. That was a grant that we had several years ago that before this administration we lost and then competed to get it back, which we did. Marcia Williams has built that team in our Housing Opportunity and Finance division, working with our deputy, Ashley Johnson-Hare, who's on with us now. They are, we've done a lot of work with the health department. A big part of this is to get word out to residents who may have lead abatement issues, get the testing done, and then connect them to abatement programs. So I can send you a whole piece on exactly what this does and what it's accomplished so far and what we plan to do if you would like.
Yeah, that would be great. And I'm looking at this personnel detail too. It shows, I'm not sure why it shows it this way, but it says full and part for personnel. This is on page, it's Appendix B1 in the schedule.
It's the full and the part-time employees.
Well, so are you telling me you have everybody listed in part-time? You have 30, you're showing you have 32 part-time employees.
Yeah, several of my staff are chuckling about that. So part-time, really, it's non-merit. Those are all full-time employees of the department. We just don't have, I think Madam AO may want to say something, but we don't have very many merit employees in DHCD.
Why do we call them part-time?
That is a nomenclature that Baltimore County has used for some years, and for the life of me, I don't know why we cannot get that nomenclature out of our records. Part-time simply means non-merit. That was the department, that was the county's nomenclature. We've tried hard not to use that because it is very confusing. These people work 32 to 34 hours, and they are very much full-time employees, if you will, in terms of working. Part-time in Baltimore County is someone who works below 25 hours, 25 hours or less. It's just a remnant that is in our system that continues to put that part-time or PT there. When you see PT, we ask that you just please convert it to non-merit. But Director Hickey's point is a point well taken. Many of his employees, the vast majority of his employees, are non-merit employees, which is a little bit unusual to have an entire department of non-merit employees. It's typically a blend and more so merit employees. So that is something that we're working on as we move along.
Okay. Madam AO, is that what we consider full-time in Baltimore County, 32 hours?
We have a range of people, but anybody working over 25 hours or 26 hours or more is a full-time employee. But our non-merit employees, for the sake of like Mr. Hickey's staff, is a full-time. They go anywhere across the enterprise, 32, 34, 36, 38, all the way up to 40. Don't ask me why. This is a system that we inherited with all of these different sub hours that go that range. We've been doing a lot of work over time to clean that up in many departments. We started with aging a couple years ago, and we've systematically tried to address this as best we can. But it was just a practice here in the county that, for whatever reason, it gave that range of hours, but they're all full-time employees.
Councilman, I can tell you from personal experience, for me and most of my team, I can't remember the last time we saw less than a 40 plus a lot hour week. So
Definitely.
I was not implying that you work 32
gotcha.
hours.
I gotcha.
But it
All
does
right,
have,
thank
I
you.
will say to you, it has implications though, because non-merit employees who typically work less than merit employees, their time earned toward retirement is earned differently. Non-merit employees earn less time toward retirement than merit employees. It's just percentages of time, how much time earned. But as Director Hickey stated, many of these people do work far more than 34, 36 hours a week. It's something that we just have to
Great.
keep working on.
Sure. Okay. All right. Well, thanks for answering those questions. I appreciate it.
Madam Mayo,
Yes. Is that Councilman Catch? Yes. Yes,
you
sir.
you got it. Are these issues a result of the negotiations with the various groups that represent employees in Baltimore County? Is that part of the issue you're trying to resolve?
No, sir, because non-merit employees are not represented.
No. I'm talking about the full-time employees where some work 32, some work 34, some work 40 hours. That's the group I'm talking about.
No, I don't believe so, sir. This is more of a phenomenon with non-merit employees, not merit employees, because non-merit employees are not represented by bargaining units.
So okay, let's say you have an individual who's been with the county for the same number of years in the same position, and let's say they're on the salary scale at 60,000, but one works 32 hours a week and the other one works 40 hours a week. Do they both get that same salary?
They get the salary commensurate with their hours worked. They, for example, if they're depending on what their salary rate is, because if one is making $42 an hour and one is making $46 an hour, of course they would make it would be there'd be a difference there. But bargaining unit employees don't tend to have that problem.
I'm talking about salaried employees, not by the hour.
Well, regardless of whether you're salaried or not, in the system, you say you have a salary, and that's the set salary for the hours worked. For example, if you have $40,000 salary and you work 36 hours, then your unit cost is divided. That $40,000 is divided by the hourly rate by the number of hours you work. And if you work 38 hours and your salary is still $40,000, then your unit rate that you're paid biweekly, it still comes down to an hourly rate.
But nevertheless, they both make 40,000 despite the fact that one individual is working fewer hours.
It's based on and that's why it goes back to the hourly rate. A job could surely be $40,000 if that's what the salary of the job is. You get paid in your biweekly pay. That's why letters, offer letters show your annualized salary and your biweekly pay.
So if you have an individual that is on the $40,000 step on the pay scale, and you have two people are on that $40,000 step. One works 32 hours a week, one works 40 hours a week. It's just the amount of money they make per hour that is different.
They divide, payroll divides that up based on the number of hours worked per week times our 26 pays.
Yeah, that to me, that's not fair. If you have the same person, two people doing the same job, making the same salary, yet one is expected to work 32 hours a week and the other one 36 or 40, there's a lack of equity there. And I just, I understand what you're saying, but
Yeah, but like I said, it hits non-merit employees more than it hits um, merit employees, because typically merit employees, the vast majority of them work a regular tour of duty. You don't find that inconsistency. You only find that inconsistency in non-merit employees, because non-merit employees' salaries prior to our administration had no scale in terms of number of hours
Mhm.
and amount of compensation. It was not equitable. And that's what we've been trying to do, is to place people on scales that are representative of jobs and work done. Classification and compensation determines how you're compensated. But the county has a very complicated um, set of classifications. But I'll tell you, the union folks ensure, when they negotiate for their bargaining units, they look at things like that. But unfortunately, non-merit employees, or formerly known as part-time employees, are not represented by the union. So we are working diligently to try to bring some equity into this.
Okay.
Mr. Chairman.
Yes, sir, Councilman.
Thank you, Mr. Chairman. And one, thank you, Director Hickey, for the presentation, and just want to also thank your staff for the work they've been doing. One, for the entire county, and just to bring our numbers down and actually have resources available to take advantage of these grants from the federal government and from the state government. Two questions, so it won't take too long. Just, I appreciate you bringing up some of the successes. I was curious about some of the folks that may have applied for housing assistance that were unable to obtain it, and wondering what you've seen or your staff seen related to some of the barriers for folks that have attempted to receive assistance but just haven't been able to get it, and wanted a chance to sort of brief us on that.
Sure. So it's important to give some scope and scale. So we started the eviction prevention work right at the very beginning of the pandemic. Back, if folks remember CARES money, we were one of the first counties to redirect CARES money to that. Keep in mind that this isn't scientific, because people could have applied multiple times. They might not have been eligible, but scale, we received almost 20,000 applications for rental assistance since the beginning of the pandemic. And as we've moved them through the system, we've been able to approve almost all of the ones that were eligible, where people got back to us and provided the documents that we needed. Approximately 500 people have inquired about rental assistance through one of our official channels since we stopped taking new applications. So we aren't able to track what happened to those households, of course. We do, at our quarterly housing stat, Heather Sheridan and her team put together stats on coordinated entry calls in partnership with Health and Human Services. So we ask people that call 887-TIME, if they're calling about shelter, how many of them have been led to this call because of housing stability issues, and it's about 1 in 4. The majority of those callers don't take us up on offers for shelter. There's an assumption a lot of them self-cure, but it puts more pressure on us to work with school systems to try to figure out, or the school system to try to figure out what students and their family might be living with others, trying to self-cure in ways that aren't ideal, but don't lead to shelter or don't lead to actual homelessness. We got very lucky. I can't emphasize enough. And I want to thank Chief Mahoney for applying to the Treasury for reallocated money. If you all recall, there were newspaper headlines a year and a half ago about counties not spending this money quickly enough. So for Baltimore County, which received a significant ERA funding in the beginning, because ERA was based on population, not necessarily need. So we put this money to good use for those 8,500 prevented evictions. This 1.15 million is literally funds that weren't spent by other jurisdictions that have been reallocated to us for Baltimore County residents. That's going to allow us to get through, we hope, the majority of those in the queue that have applied, done everything right, and they've been waiting. And then we're going to pivot to this housing stability model that's really case management, problem solving. How can we keep you in your home if we can't pay a year and a half's worth of rent? As some of you know, the state did put aside $2 million for the entire state. And we aren't sure how that's going to be divvied up yet. And so, again, roughly 500 families that inquired about rental assistance since we shut down the portal. We're working with a few hundred households that are being referred that will use this new money to serve. And then anybody with housing stability concerns in Baltimore County will always have a place to call, will always have connection to a not-for-profit that will help them address their specific issue. And this is probably a really good time to thank the council members on this call. The referrals you get to us, even if we can't pay rent, or more often than not, we've already paid rent, and they've come back a second time, it's really valuable because we follow up on all of them. So I want to thank you and your staffs for all the great communication with us.
I appreciate you diving into that for me, Director. And last question. Generally, we have a new Veterans Commission, and they've been doing outstanding work just getting their feet wet and what the county has to offer veterans. Just wanted to get an opportunity to hear from you too about the HUD-VASH voucher program, how we're doing with vets in the county, and especially in the veteran community, we talked about functional zero, how we're doing related to getting close to that, and how the council can play a role in advancing that goal for you.
Okay.
Right, thanks. Great question. And I'm going to follow up. I'll send to the council. We have a slide that I don't have in front of me right now, I'm afraid. We have done, and when I say we, I get to brag about Heather's work with COC and her team. We have been really working to build up that direct line of communication with the VA. One of the challenges with housing a homeless vet is the massive amount of paperwork and documentation that go into that. And so you can have access to VASH vouchers, but if you don't have a system that allows for the proper documentation, you're not going to move folks through. For those who don't know, when the councilman says functional zero, you're never truly going to end homelessness. Unfortunately, I don't know of a place that's been able to do that. Functional zero means you have a system that can accommodate a housing pathway for anybody who enters that system. So, for instance, we have. I'll get you numbers on the number of vets that we've housed over the last couple of years, but it's gone up significantly. We have 20 vets in the queue right now to be paired with VASH vouchers and to be housed, which is a tremendous amount for Baltimore County. As we've reported and talked about in the past, there's no guarantees. We don't know what the future is going to hold in the way of new folks in the system, but we are prepared within the next year to be in striking distance of functional zero, which would put us as the second county in Maryland to do that. I love my team because I'm getting extra stats while I'm talking to you. And so the few other things, again, I mentioned 20 vets in the queue right now for actual vouchers. We have 28 names on the vet by name list. That's really important because that means you have, because remember, we also have to confirm their status with the VA to make sure they're eligible. A lot goes into that. So 28 names on the veteran by name list. And between February and May of this year, we've housed 20 vets. And for those 20 vets I told you about, they're in the queue. They've already been approved by the VA. So quietly, we are really doing some incredible work getting these vets into permanent housing. And I hope to be in front of you all soon, making an announcement next year about Functional Zero.
Amazing news. And thank you for the update on that. And looking forward to
Thank you.
it. Thank you, Mr. Chairman.
Thank you, Councilman Young.
Mr. Chairman,
Yes.
yes, Mr.
Councilman
Hickey.
Katz, go
Yeah,
ahead.
Mr. Hickey, are you all participating on May 27th at Hereford High School at 1 o'clock in the Veterans Resource Fair that is being put together by people in northern Baltimore County? It's the Eyes of Freedom program.
I don't know the answer to that, Councilman, but I will find out. It sounds like something we'd want to be involved in.
Right, right. And absolutely, because one of the issues, of course, is housing. And so it's 1 o'clock, Hereford High School, May the 27th. And it's called the Eyes of Freedom program. They're having displays. It's going to be there like a week. They have displays,
That's great.
etc. So, but the resource day is Saturday, the 27th at 1 o'clock.
That's great. I can tell you the organizers have done a great job, because Heather's telling me that they got us all that info, and we not only know about it, but we've pushed that out to all of our continuum of care
Good.
providers,
Good,
which is where the real magic happens. So I think they'll be well represented.
good, good. Are you all going to be there?
I will confirm that with you.
Good, good. Thank you.
If you're going to be there, I'll be there, Councilman. I'll come
I'll
by.
be there. I'll be
All
there.
right.
I'm needy.
Mr. Chairman,
Councilman Katz, yes.
I thought you'd agree with me. Yeah.
Mr. Chairman.
Yes, Councilman Marks.
Okay, thank you. Mr. Hickey, I wanted to draw your attention to the Neighborhood Stabilization Conservation Fund in the auditor's notes. And it says that the department has identified 21 designated areas and that there'll be an application process for this funding. Will we get a copy of where those neighborhoods are located?
Of course. And the marketing. I think the big key to this is getting the word out. So yes, glad to circle back with you on that.
Okay, and as the auditors make the point of asking how the county ensures to seek fairness in the process of making opportunities, are these areas generally located throughout the county?
Yeah, and keep in mind, all of this money is very, very tightly intertwined with federal and state fair housing laws. So there's a lot that has to be done here in both the analysis and the marketing to make sure that the information is disseminated widely and that people have fair access to this. So absolutely, sir.
Okay, so that's something you all can get us, right?
You bet.
Okay,
Yep.
Thank you.
Sure. Great questions. Thank you.
Mr. Chair.
Yes. Thank you, Councilman Marks. Who's it, Councilman Crandall?
Did you? I've worked with you for 8 years, Councilman Jones. You forgot my name? Damn.
I could not see who was. I was looking through my sheet to try to see who was lit up. I couldn't catch your voice.
Oh, I'm lit up because you forgot my name. I'm lit. All right, enough of that. I'm sorry. Director Hickey, your passion for your job always shines through. So thank you for that. I think it's infectious. So I have a couple questions for you.
Sure.
So the VCA that honestly I've never been a big fan. I think you already know that. Sort of, can you help me clear a disconnect that I have? Okay, so the county's on the hook because of this settlement for 1,000 new units, and it looks like you've achieved a little over halfway to that number. It looks like. So, to clear up this disconnect for me.
Sure.
So we have overcrowded schools. we have traffic situations in a lot of our higher density areas in Baltimore County. Um, we, but we want to create more density within neighborhoods. And to me, these things contradict each other. And, for me, I mean, my district is, not real interested in a lot more high density. We're pretty much built out. So apartment proposals really stop at my desk, and I say no, not in our district. And you know that, and the developer community knows that as well. But so I can't speak for other members, but and we're not part of the VCA map either. But can you help me clear up that disconnect between sort of policy and the fact that we are facing situations with adequate public facilities within numerous sections of Baltimore County?
Sure. Well, it's a complicated topic. I won't try to do a disservice to, but I'll try to give you a summary. And then I love discussing these issues. We can do some follow-up. You framed it as a VCA issue, but I think it's a much bigger issue than that. And the issue is the data shows two things of many. One, even though we're a built-out county in many aspects, we're still a growing county that the data shows a desperate need for additional housing. And I know sometimes that seems counterintuitive, but we need more housing for everyone. And because of historic patterns, we don't have nearly enough housing for the working class families and others that need to support the growing economy of Baltimore County. So, but to me, that's not a VCA challenge. That you described it. It's a housing development challenge. Ashley, who's on now, our deputy, works with Marcia Williams and talking to developers constantly. And I think, as I've said to many members of the council, we have to be thinking, because of those realities, about redevelopment. What are parts of the county, types of properties, old retail, old commercial that are dead, that don't serve a purpose, that could be rethought of and repurposed as not just housing, but vibrant mixed use, mixed income? We have to think about old apartment buildings that are in pretty bad shape, that are in danger of being sold and run. Councilman Marks, we've talked about what happens when properties aren't run well and they're acquired by investors. So we need to think about acquisition and preservation of existing units that can be preserved to be affordable for different types of incomes, while not putting too much additional stress on those communities. So no, these are challenges. I think the VCA puts a fine point on it, but working with all of you to figure out the right way to do housing development, taking infrastructure needs into account, and figuring out how can we recycle pain points in communities, dead zones in communities, into vibrant housing and other uses is going to be the challenge we're taking on in the coming years.
Okay, I'm not sure you cleared up my disconnect, but
I'll keep working on it.
I'm not going to belabor it. You're always welcome to come down to the district, and we can have one of our free flowing discussions that we've had over the last few years.
You got it.
So with the 585 hard units approved, 462 hard units constructed, going back to the VCA, can we get a map or a spreadsheet of where these units are located?
I think we already have that. I'll double check. We've got the maps of the different zones under the VCA, and we've mapped the major developments. There's a lot of single scattered sites, but yeah,
I'm not sure I don't know. I'm not sure if that's come to our office at all.
Okay.
So if we could get that. We'd be interested in seeing that. So one other thing, or there might be another, but I want to talk about the code enforcement program. Can you elaborate on the, so it's 70,000 for this program. So, can you answer what's the source of funding for that? And then just elaborate on the program. This is something new, is it not?
So I'm going to underwhelm you on my answer, Councilman, because that's in there at least a couple of, because we have to plan it's CDBG, so we have to plan that early. A couple of years ago, before Director Gutwald was really getting going with the expansion of the work, we tried to inject some CDBG into code enforcement. It's an ongoing discussion because with the data collection and everything else that's needed under CDBG rules, Director Gutwald went out and got additional positions funded directly through last year's budget process. So it's not our program. We were helping out PAI, trying to see if we could inject some CDBG to expand. But the partnership with PAI, particularly around vacant and derelict properties, I think is something that's bigger and going to bear fruit for the next any number of years. But that piece that's in the budget was simply an attempt to help provide some additional gap funding for PAI around code enforcement, particularly in low to moderate income communities.
Okay, yeah, I mean, I agree with your earlier statement that this inventory of vacants and chronic code enforcement issues. Yeah, there's PAI, but your agency obviously plays a role in that too. And I think that inventory is gonna, as you said, is gonna bear fruit as we move forward. Nonprofit public capital improvement program. What is the source of funds on that? Is it all grant funding?
Yeah, it's all grant funding. I'm thinking,
Okay.
so Colleen, it's mostly CDBG, right?
Yes, it's CDBG, and it generally is capital projects that we do for alternative living units to help individuals living with disabilities in the community, and other sort of larger capital projects to nonprofit organizations who are meeting low and moderate income needs in the citizens.
Yeah, many of you know CDBG better because of the grants that we bring through Grants Review Committee that you get notified of, where we're funding a number of the nonprofits programmatically. But the bigger chunk of CDBG nationally, including us, is generally moved towards capital type projects. So and we're looking to do more of those in the future.
Okay, well, I think it's evident that your agency is very adept at bringing these grant funds in. And the administration actually in general, I think, has made great strides compared to previous administrations on attracting grant funding to help us out with some of these initiatives. So I thought that I had one more for you, but I'm complete, and thank you for everything. And I know you're always available to talk these things out. I appreciate that as well.
Thank you, Councilman.
All right. Thanks, Mr. Chair.
Councilman Crandall, Councilman Batoka?
Yes, thank you, Mr. Chair. A couple of my questions were already answered by my colleague, were asked by my colleagues and answered by Mr. Hickey. So I just have one question left and then one comment. On the Live Near Your Work initiative with LifeBridge, in partnership with LifeBridge Health, would it be possible to get a map of the targeted locations and also the tiered amounts of both the LifeBridge contribution and the county contribution? For the Sinai Hospital service area, I think a good portion of my district, along with some city areas, may be impacted. And then for Northwest Hospital service area, I think the Liberty Road corridor, both in the area I represent and the areas that Chairman Jones represent, can benefit through Live Near Your Work program. I'd like to see the breadth of those maps and also the tiered dollar amounts associated with it, so we could help promote it, actually. Because sometimes I know I used to work for LifeBridge Health, and so getting the word out was part of the challenge amongst the employees.
Right. I'm looking right at Milana Boehner, who will give you a quick update. But yeah, we'll get that to you. We're excited about getting this revved up again.
Great. And then the comment, I couldn't help but I would like to chime in on the merit, non-merit discussion, because back in the day when I was Deputy Director of Planning, I was a non-merit employee, and we were, and back then, and it may have changed now because this was a long time ago, the non-merit status would give you a lot more flexibility in hiring and at salary points. So, for example, and I know my colleagues may relate to this, is we were able to hire non-merit employees as we approached this, when I was in planning, as we approached the CZMP, because we needed additional mappers in place. to help map issues. And so we didn't have that in the stack that we had in place. So we would hire non-merit employees because that process was much easier. And while it was a good management tool, it wasn't necessarily fair to those non-merit employees. And so I was hoping that 20 years later, we would have moved away from having two class of employees. And I know that Ms. Rogers has said that we've taken steps to move away from that. And I didn't know if the conditions were still the same, where it gave you much more salary flexibility, much more hiring flexibility, or if it's just something that's just hung around there and hung around in their human resources system, and we're still trying to kind of fade it away. Any thoughts on that, Ms. Rogers?
Thank you, Councilmember Patoka. Non-merit positions will always exist, but like any other government and equity in employment and compensation, in mainstream HR, you determine a job, then you determine how much should a person doing this job be compensated. Then you determine whether that is going to be a merit employee that's covered by a lot of protection, a lot of other amenities and so forth, like leave days, how much time they earn and accrue in time toward retirement, etc. In the non-merit system, and you know, we've worked in different systems, non-merit is pretty much what most jurisdictions also call at will. You want to have the flexibility in hiring, but you do have a scale that you have to go on. Unfortunately, in the evolution here in the county, it appeared that because there was no scale, so people just used merit scale amounts of money. So while it's gotten better because we've tried to bring equity, we have equity now in terms of at least offering a few days of leave. We look at positions, whether it's merit or non-merit, and look at what is the job and how much should be people be compensated, so that you don't have these wild swings in how much people are compensated, even if it's a short-term kind of scenario like you're talking about. It's easy to bring a person on who's non-merit and short-term, which we used a lot of during the pandemic. But in a traditional system, having merit and non-merit, and I use Mr. Hickey's department as an example, I know of nowhere in any government structure I've been in that 99% of the staff in a department is non-merit, or in other words, all at will. Because what is the rationale for that? There are people doing similar jobs in other jurisdictions that are merit employees. So we have a little bit of a, work to do on what should be, when we should use non-merit positions, because merit positions for individuals have more benefits for them. And now we're looking at paying people equitably for a job done.
Right, I agree with you that people need to pay, fair wages and fair benefits, and that's why I hope we can get Mr. Hickey's staff and staff throughout the county to a single fair system where we don't have two classes of employees. But I know it's easier said than done, and I understand some of the challenges, but I just could appreciate your comments on that, Ms. Rogers.
It's one of my biggest projects. Thank you.
Sure. Thank you.
Any additional questions or comments from the members? Well, Director Hickey, I want to thank you for your presentation. And of course, I'm going to thank you and your staff for the hard work you continue to do each and every day. You and your team have been nothing short of incredible. And I really appreciate working with you and appreciate the hard work each and every one of you do. So thank you very, very much.
Mr. Chairman, means a lot.
Sure. And now moving right along, not to take anything away from the hardest working people in show business, and that's Dr. Branch in the health department. And we certainly appreciate all you have done and continue to do. And you guys remind us that COVID came along. You took it like a champ. You handled it, and prior to COVID and after COVID, and you continue to do all the things to keep us safe. A lot of things that a lot of us don't, we forget about: opioid abuse and all the other issues that has happened in our community, whether it be teenage pregnancy or you name it, you're there. So I'm very fortunate to have an office being shared with the health department in Randallstown, and I see all the services you provide, and I really appreciate it. So without further ado, we're gonna go to Lauren. Lauren, take it away.
Okay, so I would like to introduce Reginald Sullivan from our office, and he will give an overview first for the local management board's budget.
Okay.
Good afternoon. The proposed fiscal year 2024 budget for the local management board totals $3 million. Of this amount, the county's local share contribution of $44,000 is level funded from the fiscal year 23 contribution. This county contribution does not appear as general funds within the local management board budget, but rather appears in the county's standalone local share program. As you can see on page 2 of the analysis, the budget increases by $271,000 or 10%. The budget increase is driven by the increased level of funding for several grant programs. On page 3, the stacked historical bar graph chart shows the budget history spanning from fiscal year 2021 to the proposed fiscal year 2024 budget. The chart shows L&B's spending categories. On page 3, the pie chart demonstrates how the proposed funding will be allocated across the board's restricted grant programs. As you can see, Multi-Systemic Therapy Plus represents the largest anticipated grant for the upcoming year. On pages 4 through 6, the analysis provides information on the various grant programs and highlights increases from fiscal year 23 to fiscal year 24. Topics for discussion related to how L&B communicates with the public about its important work are presented at the bottom of page 6. At this time, I would like to turn it over for discussion.
Any questions or comments from the members? Lauren, is this the plan? You're going to do 3 in a row or just 3 separate? Keep them separate?
Yes, please. If we could keep them separate for the individual packages, we'll give an overview for each. And then Dr. Branch can discuss each.
Okay, Dr. Branch.
Can you hear me?
Yes.
Okay, then. So I will say to you that local management board is a part of Health and Human Services. So I am actually prepared to discuss the Department of Health, Department of Social Services, and local management board as an entity of Health and Human Services. And so I would prefer to do it that way if possible. So can we present the other departments, and then I could kind of go over all of them together?
Absolutely. So I will invite Kim Bauer Weeks from my office, and she will first give the overview for the health department. And then after we go through that, we have a separate presentation for the Department of Social Services.
Do you want me to do both of the presentations, one after the other?
Looks like Dr.
Yes, if
Branch
that's
would
okay.
prefer that.
Yes.
Okay, that's fine. Just want to make sure. Okay, thanks, Dr. Branch. The proposed FY24 budget for the health department totals $133 million. a decrease of 62 million or 31.7% from the FY23 budget. As you can see on page 2 of the analysis, the general fund budget totals 28.4 million and increases by 1.8 million or 6.9%, primarily due to personnel expenses such as COLAs, 7 positions previously ARPA funded, increments and longevities, and personnel annual review, partially offset by increased turnover savings. In addition to this general fund support, nearly $5.3 million, an increase of $33,000 over FY 2023, is budgeted to flow through the county's general fund local share program appropriation to support the local matching requirements for 8 of the department's grant programs. The budget package omits reference to the local share program appropriation. The special fund portion of the budget, the largest portion of the budget, totals $104.6 million and decreases by 64 million or 37.9%, primarily due to the abatement of harms from the opioid epidemic grant, $59 million, which was fully appropriated in FY 2023, but is non-lapsing and available for use in future years. And one-time FY 23 grants partially offset by funding for new grants, $9 million. On page 3, the exhibit displays the department's budget history as well as the general fund reversions. On page 4, the pie charts show how the proposed funding will be allocated across areas of spending. The special fund continuing grants represent the largest program allocation, while personnel costs represent the largest type of expenditure. On page 5, the analysis notes the areas within the budget that support new expenditures or reflect budget flexibility, where potential reductions could be identified if the council wanted to explore such options. Operating budget highlights, which begin on page 6, include general fund highlights of personnel and departmental initiatives, and special fund highlights of crisis services, opioid epidemic and related grant funding, continued impact of COVID-19, and CDC strengthening local public health infrastructure grant. Additional topics for discussion, which begin on page 12, include American Rescue Plan Act, ARPA funding. Capital budget highlights begin on page 13. And that's the summary for the health department. If we move on to social services.
Thank you very much.
Thank you. The proposed FY24 budget for the Department of Social Services totals $25.3 million, an increase of $1.2 million or 4.9% over the FY23 budget. As you can see on page 2 of the analysis, the general fund budget totals $14.4 million and increases by $515,000 or 3.7%, primarily due to personnel expenses such as COLAs, increments and longevities, and a position transferred in from the county's ARPA Gifts and Grants Fund program. This is partially offset by an increased turnover savings assumption. In addition to this, general fund support, nearly $1.9 million is budgeted to flow through the county's general fund local share program appropriation to support the local matching requirements for 7 of the department's grant programs, including $1.3 million for the Federal Supplemental Nutrition Assistance Program, also known as SNAP, as noted below under special fund. The special fund portion of the budget totals $10.9 million and increases by $675,000 or 6.6%. This increase is driven by the county's increased local share contribution to the SNAP program and partially offset by a lower level of anticipated federal grants. Details of the ups and downs of all the programs, including the various grants, are provided at the end of the package in Appendix A. On page 3, the exhibit displays the department's budget history, as well as the general fund reversions. On page 4, the pie charts show how the proposed funding will be allocated across areas of spending. The special fund grants represent the largest program allocation, while personnel costs represent the largest type of expenditure. Also on page 4, the analysis notes the areas within the budget that support new expenditures or reflect budget flexibility, where potential reductions could be identified if the council wanted to explore such options. Operating budget highlights, which begin on page 5, include a general fund highlight of budgeted personnel costs and a special fund highlight related to the federal SNAP program. Additional topics for discussion begin on page 7, and again include ARPA program spending plans, working group on resource coordination to support victims of sexual exploitation, violence, and domestic abuse, and challenges facing the department. Thank you, Chairman.
Thank you very, very much. Any questions or comments from any of the members on the 3 presentations? Hearing none, Dr. Branch, you have the floor.
Okay.
And our undivided
Good
attention.
afternoon, Chairman Jones and members of the Baltimore County Council. Thank you so much, Reginald and Kim. I will say to you that I count it an honor and a privilege to be before you today. I'm both grateful and thankful for this opportunity to speak with you about the Department of Health and Human Services, which includes the Department of Health, the Department of Social Services, and the Local Management Board. Please allow me to take this time to introduce my leadership team, Della Leister, who's the Deputy Health Officer, Mark Millspar, the Deputy Director of Social Services, Lawrence Richardson, the Deputy Director of Finance and Administration, and Don Schlimm, which is the Executive Director of the Local Management Board. I come to you before you today personally, proudly, and passionately representing Baltimore County Department of Health and Human Services, an agency that I am so very blessed to lead. An agency that carries out its vision of healthy people living, working, and playing in Baltimore County through a plethora of services and programs. For many, HHS is a lifeline. It's a lifeline that is there when needed. It's a lifeline that is there for those who find it difficult, if not virtually impossible, to stay afloat amidst the sometimes very turbulent tides of life. HHS continues to be an anchor of support, a beacon of hope, and a lighthouse to those in need. I am excited to share with each and every one of you that the Department of Health and Human Services has achieved another accreditation. The Department of Health joins our Department of Social Services and Child Advocacy Center, who are already accredited. The Department of Health was conferred accreditation by the Public Health Accreditation Board on March 3rd of this year. This rigorous process spans several years and involved measuring our performance against national set of evidence-based public health standards. And I guess I could take this opportunity to thank the HHS team members for the unyielding dedication. Not many HHS departments can tout accreditation in all three of these areas. It's a wonderful accomplishment and one that sets us apart by demonstrating a continued commitment to quality in which all of Baltimore County should be proud. I'll touch on this COVID-19. Despite the ending of the worldwide public health emergencies of COVID-19, HHS remains on the job. Why? Because our communities, especially those that are historically underserved, are in dire need for additional help, additional assistance, and recovery from COVID-19. We must continue to educate, advocate, and link those we serve to programs and resources and continually provide interventions to support prevention and wellness. We must continue to be that anchor, that beacon, and that lighthouse to address ongoing challenges like mental health, substance abuse, and day-to-day economic struggles. HHS continues to be a lifeline for citizens struggling to pay rent, struggling to pay utilities, to buy food, and to access medical care through many programs. And many of those programs that we have include energy assistance, our WIC programs, SNAP, M-CHIP, temporary cash assistance, and medical assistance. Some of the efforts in some of these programs included, we provide nearly $20 million in federal funding in our SNAP benefits per month to county residents. That's $20 million per month to our county residents. And most of that money is spent in the local grocery stores in Baltimore County. And those stores basically are hiring local employees. We're also delivering summer SNAP benefits, which allow us to provide additional funding to families with children. And that's thanks to a $2.9 million in funding from the county and state funds. We coordinated food pantries, and we prevented working with housing under Director Hickey, preventing over 300 families from being evicted. We are the safety net that helps prevent people from hitting rock bottom. However, the fact remains that despite our efforts, people can and do fall through the holes of our net. So we must not relent in our efforts to providing care home to home and heart to heart. Let me just take a few moments to discuss the opioid epidemic, some of its trends, naloxone and funding. The number of overdoses still remain high because one is too many. But there's been a small decline since 2018, and much of this may be due to the ongoing efforts to get naloxone into the hands of those who need it most. And this is accomplished by virtual and in-person classes, presentations at community organizations, and efforts to partner with businesses that have higher than normal overdose activities. It's imperative that we change the stigma associated with substance abuse disorder. Remember, addiction is a disease and not just a matter of choice. We must treat it as a disease. When I trained in internal medicine over 30 years ago, when a person came into the emergency room because of an overdose and was found to have illicit drugs in their toxicology report, many a times methadone clinics would decrease the amount of their treatment that the person received. I have to stress, substance use disorder is just like any other disease process, and we must treat it as such. We've got to change the stigma. Let me give you an example. If we had a person who was hypertensive, obese, and a diabetic, who's driving down the road, and they decide to have a 2-all beef patty, special sauce, lettuce, cheese, pickles, onions on a sesame seed bun, and they decide to have a large French fry and a Diet Coke. If they wound up in the hospital 4 hours later with a very high sugar, or 500, and diabetic ketoacidosis, we would never not give them insulin. We would give them more insulin to treat their condition at that particular time. And the same thing has to happen when somebody is having the struggles, substance use disorder. If a person came into the emergency room who was an asthmatic and they were smoking, we would still give them that nebulizer treatment. We would give them more treatment to get them out of the crisis. So we've got to remember that. And here at HHS, we have taken proactive stance in addressing the opioid epidemic through many of the services that we offer. We offer Narcan training, needle exchange, substance-exposed newborn units. We have an 88 REACH helpline, HIV testing, hepatitis C testing, immunizations like tetanus, hepatitis A, and hepatitis B. We offer wound care. We have a Leave a Dose of Narcan Behind, which is a partnership with EMS. We have a drug overdose lethality review team. We have our next of kin interviews, an overdose to action program with a just-in-time database, medication-assisted treatment in our detention centers, an opioid intervention team coordination, a screening brief intervention referral to treatment, which is called ESPERT, in our school-based wellness centers, and of course, we've got our peer recovery services. Now, what I want topic of substance use, I will mention the recreational use of cannabis, and that is a potential emerging public health threat. We don't have our robust health research data to fully understand the public health implications of recreational cannabis usage. But as we know, illegal substances like alcohol and tobacco have had a catastrophic effect on individuals, families, and communities. For example, the gateway drugs, or driving while under the influence, or cancer and chronic disease risk factors. So I'll ask you to stay tuned as we learn more about the ramifications of recreational cannabis usage. Talking about the number of opioid deaths that occur, despite the number of opioid deaths that occur, we must also be cognizant of the fact that heart disease is the leading cause of death in this country, in our county, and in our communities. My philosophy is and has always been that the strength of a county, the strength of a country, the strength of a community is seen in and measured by the strength of its families. So we must continue to be an anchor, a beacon, and a lighthouse to strengthen our families. Therefore, it is essential that the Department of Health provide services for chronic diseases like diabetes, obesity, tobacco usage, and high blood pressure. Our chronic disease program has a multidisciplinary approach. It's staffed by a physician, nurses, a nutritionist, and community health workers. Our current focus is to provide education, advocacy, and linkage to care to communities of color who are at high risk for heart disease. The staff collaborated with many community and faith-based organizations, and some of the programs that we have is a TOPS program, Taking Off Pounds Sensibly. We've got diabetes and hypertension screening, and also nutritional education. I'll talk a little bit about our mental health. Mental health remains a crisis. Stigma, misinformation, misunderstanding, and lack of knowledge in these areas still exist. Most recently, we supported the addition of a licensed clinical social worker in the 911 center. And this position provides immediate brief counseling to de-escalate potentially volatile situations and provide linkage to the most appropriate level of care. Remember that the department does not generally provide direct mental health services, but we continue to oversee and coordinate crisis services in Baltimore County. And one of our goals is to continue to drive the mental health system towards using evidence-based practices. And the department is initiating several funding programs, including mental health grants to the community, mental health first aid training to the community, and mental health campaign for public awareness, and a trauma-informed care training for our employees. The local management board. The local management board is a board that consists of representatives from child-serving agencies, including the Baltimore County Public School System, libraries, DSS, health, local enforcement, I should say, and members of the community. The local management board is staffed by 3 professionals under the leadership of Don Schlimm, and is similar to the Department of Health and the Department of Social Services, receiving administrative, fiscal, and FHR support through a consolidated health and human services. The local management board coordinates among the child-serving organizations in Baltimore County to identify challenges and improve overall outcomes for children, youth, and families. So for over 2 decades, the local management board has been focused on bridging the gaps in behavioral health system for children, our youth, and their families. All management board funded programs have a strong system. The Cognitive Behavior Therapy Plus program served over 850 children and youth in fiscal year 22, and approximately 95% of those children and youth were by the Baltimore County public school system. So, in conclusion, without a shadow of doubt, HHS remains on the job 365 days a year, 7 days a week, and 24 hours a day. We must remain vigilant and ready for the next potential pandemic, while simultaneously working to address other social issues and public health threats like child abuse, elder abuse, family instability, sexually transmitted infections, communicable diseases, and low birth weights in our newborns. One of the most things that's challenging facing healthcare today, that's locally and nationally, is filling critical positions. We need registered nurses, we need social workers, and we need alcohol and drug counselors. I'll appeal to you. If you know someone who's a registered nurse, a social worker, or an alcohol and drug counselor aching for a rewarding career, let them know that there's a doctor in the house and I am on call. Tell them to give Dr. Branch a call and I will relieve that ache. I will do that because I will provide them with an opportunity to join our nationally accredited team by the name of Health and Human Services. And they will receive refill after refill. A refill of personal joy, a refill of satisfaction, and a refill of fulfillment that comes with performing a job that makes a difference in the lives of the people we serve in Baltimore County. So I thank you for your time and attention that you've given me today, and God bless each and every one of you.
Thank you, Dr. Branch. We certainly, no doubt about it, really appreciate the presentation. Are there any questions or comments from the members?
Chair, I have one question, if I may.
Councilman Nuttall?
Yes, Dr. Branch. Question on, you brought up the recreational use of cannabis that will probably, my note says will likely drive more need for addiction services. I don't know if that's a correct statement, but do we know from the state whether there's going to be money allocated to the local jurisdictions for additional treatment and anything that would lead to maybe gateway use?
Right. So we don't know that for sure at this time. The health officers have been asking these questions. We have a lot of reservation as it relates to recreational use of cannabis. And we know that when it came to tobacco, we know when it came to alcohol, we know that there were clearly public health threats regarding that. So we're going to assume that it's going to be the same thing when it comes to cannabis. And we're hoping that there's going to be some funding that's going to come down so that we can actually help prevent some of the ills that it's going to cause.
Okay, good. One other question. There seems to be the largest increase in budget has to do with school-based programs. Can you speak to that?
Can you give me some more specifics on exactly what you're referring to?
So on the there's miscellaneous Woodlawn school-based wellness programs, miscellaneous school health services enhancement. And they're all going up 32%, 62%.
I'm not specifically sure exactly what that is. I do know that we are continuing to partner with the school-based so that we are actually providing a lot of services there, and we are getting more students that we're working with. But I'm not too sure specifically what you're talking about in regard to that increase.
Okay. That's all I have, Chair. Thank you, Chair.
Thank you very much, Councilman Hertel. Any additional questions or comments? I see Councilman Marks.
Thank you very much. I want to thank you very much, Director Branch, for all that you've done. I also want to thank you for bringing up and Councilman Hertel reinforced this, the issue about the public safety effects of increased cannabis uses. I strongly opposed the recreational use of marijuana. I think the General Assembly acted very fast many ways, and I'm very curious to see how we're going to be dealing with the public health effects of this increased drug use. So appreciate your observations there, and as soon as we know what sort of funding will be available from the state, I'd be interested in hearing about that.
Okay, duly noted, sir.
Thank you, Councilman Marks. I believe I saw Councilman Young.
Thank you, Mr. Chairman. Thank you, Mr. Branch. Excuse me, Director Branch. Wanted to question either for you or any member of your staff related to the health department's budget. There was 1.5 million in special funds in a new potential grant that you all decided or chose not to pursue for the racial and ethnic approaches community health grant. I just was wondering what was the, just curious why we weren't going to pursue that, or why that was chosen not to be pursued.
So what happens is the fact that we have probably 88% of our budget is going to be for grants. And so we're always pursuing different grants. And so as we're going through the whole process of looking at what we can actually do, sometimes we go for grants and sometimes we don't go for grants. And so at that particular time, we were evaluating that, and we felt that at that particular time, I did not believe that that was going to be the best grant for us to pursue at this particular time.
Understood. And so sort of in the same line, but not, because I don't know your timing for these decisions, so I don't mean to tie them together. I'm just curious because now we have the New American Healthcare Access Task Force, and was curious if you had, for us, sharing some timing or membership, what you see at this point. I know it's early, what we can expect to hear from you over the next 12 months related to standing up that task force.
Right. So obviously it's very, very new. So at this particular time, I can't give you any definites and definitives on that, but it's something that we're excited to be a part of. And so we as a department have already been asked to participate on that, and we're excited about what that's going to bring.
Gotcha. And I don't want to tie two things together. That I don't want to speak in a glibly about this, because it seems like there might be a connection there related to the grant and to this task force, or maybe after the task force gets started, it might be able to, address some issues that could be either funded or supported by those grants, and hopefully they're available in the future. Just wanted to try and get a clarification on that. Related to social services, it was referred to that we'll be standing up you'll be standing up the assistance or supports for sexual assault victims, the work group on resource coordination to support victims of sexual exploitation, violence, and domestic abuse. I know that you'll all be standing that up, and it's a little early, but still wanted to give you an opportunity to kind of tell us what we can expect to hear from you over the next 12 months.
Yeah, I think at this particular time, that is something that we would love to be able to participate in, to be able to get all of those particular agencies together so we can actually talk and think about the challenges that we're facing and how to build and to improve the services that we have for our constituents. So that is in the works, and we're going to hopefully be able to work with all of those agencies to be able to do that.
Great. Appreciate it, Dr. Branch. Thank you, Mr. Chairman.
Thank you, Councilman Young. Any additional questions or comments from the members? I see
Yes, Mr. Chair.
Madam, I believe, go ahead, Councilman Batoka. No, Councilman Batoka, why don't we let, Madam AO go first? Her hand was up first.
Okay.
Thank you, Mr. Chairman. I just wanted to follow up a little bit, Councilman Young, with respect to the New America Task Force. Quite naturally, when we get the information back and the feedback from that task force, and we know more about what kind of services and other kinds of supports are needed, the first thing we do is begin to look for grants and other kinds of resources to help support whatever it is we need to do. That's job one, which clearly was something that prior to the current administration looking for other grants and private philanthropic money was not necessarily the focus, but the team knows my position about those kinds of efforts and endeavors. We determine what it is we need, and then we try to identify what resources are out there in the universe to help support those needs, because community needs are continuously changing and evolving, but we do know that local funds cannot cover all of the needs that we have as a county. So we have shifted that mindset to be far more proactive about pursuing grant funds to help support the emerging needs in the county, regardless of what discipline it is. That is indeed our mindset. Thank you, Mr. Chair.
I think we might have lost the chairman.
Right there.
So I'll just go ahead while we have a pause. Mr. Chairman, are you back?
Yes.
Okay. I just wanted to acknowledge the great work of Della Leister. I call on her quite often on issues that are in my district, and she is always very responsive and also very thoughtful. So I don't have a question, but I just wanted to acknowledge the great work of Della Leister. Thank you.
Della, I'm gonna give you a hand clap, Della. The Hercules.
I agree with Councilman Patoka.
Thank you. Any additional questions or comments?
Yeah, Mr. Chairman.
Yes, Councilman Catch.
Yeah, thank you. Dr. Branch, there's no doubt that during the COVID pandemic, our county was ready and probably did one of the very best jobs in this nation. And what you said to the council, I guess it was a year ago or months ago, that basically your department was ready for a pandemic such as the COVID issue. My question is, I'm very concerned, and I do think it was a mistake for the voters to legalize marijuana for recreational use. Can you give us some idea as to how your department will deal with this problem? I mean, you have a staff that works so hard. You just mentioned that you have a need for social workers, a need for doctors. Is that what you said, I believe? And, I just, could you give us some of your thoughts about dealing with this recreational marijuana? As you know, I was a teacher. I did see the results of marijuana use with some of my students, and I'll tell you, it is very it can be very damaging to somebody's life. And it is very damaging to many lives, many young people. So if you could give us some of your thoughts, I'd appreciate it to at least, okay.
Yeah, so we actually approach many of these issues with the same foundation. So the foundation that we have with Health and Human Services is promoting health, preventing disease through education, advocacy, linkage to care and treatment. So that will be the same exact approach we would do when it comes to recreational cannabis. What we would say is the fact that we've got to educate the population. And that's one of the things that I'm hoping that they'll give us some funding for, to be able to educate the population about the issues that we're having with potentially can have with marijuana use, recreational marijuana use. In addition to that, we have our 88 reach line, so that people can call in, so that the families are really seeing some issues with their loved ones when it comes to that. We'll be hearing about those particular things so that we can actually get to them for education, advocacy, and linking them to care. At this particular time, we also are waiting for guidance from the state health department as to how we should approach this. We're waiting for them for guidance, and we're waiting for them for funding. So we're kind of at that, let's wait and see what's going to actually happen. As you guys know, the decision was made, and so then we have to, as a society, unfortunately, suffer through some of the consequences of that.
So what you're, Dr. Branch, we're ready, but need these extra funds in order to educate people and to answer or help those families and individuals who have an addiction problem when it comes to cannabis. Is there, I mean, we certainly waiting for those funds. Is there anything that your department has done to try to educate the people of Baltimore County about this issue? It doesn't necessarily take any money sometimes to educate people, and I was just wondering if what you've been able to do so far.
Right. So we actually educate from a global perspective when it comes to, when we talk about opioids, we're not only talking about opioids, but talking about all substances. And that is going to be alcohol, and that's also going to be tobacco. And we also talk about marijuana. So in all of our campaigns, we're talking about all the drugs. Remember, when we get certain monies, in the way it works out in public health, when you get certain monies, it's earmarked for certain things. And so we've got to focus it on what it's earmarked for. But we actually use that money also to be able to educate them on other things. So I may have opioid money, I may have tobacco money, but the message is going out. So about marijuana, if that makes sense, because we know that marijuana is a gateway drug, and we've been talking about that. I will just say to you, this is public health. Welcome to public health. What happens is the fact that the federal government and the state government doesn't really fund us for what we know is potentially going to happen, right? Unfortunately, it happens. We're starting to suffer through it. And then some funding occurs. That's what happened with H1N1. That's what happened with Ebola. That's what happened with COVID. That's the way they treat the public health threats. They wait for them to actually become an issue, and then they start to throw a little bit of money at them. But the horse is almost out. It's out the barn at that time. But this is the way it's been happening for decades when it comes to public health.
So you, I think it's pretty obvious with this issue that we cannot rely on the federal government. I mean, they don't even sanction what Maryland is doing or other states with recreation cannabis. So you feel like you have a good relationship with the state if and when we need their assistance, and of course you have the county, and so those resources are there. But again, the federal government, I'm sure, is not going to get involved in this.
So wait, so Councilman Koch, I will say to you this. We in Health and Human Services have an outstanding relationship with the state at this particular time, both on the social services side and on the health side. I don't know if that wonderful relationship is going to parlay into a whole lot of funding, but we have a good relationship. We have an open communication. They're hearing what our concerns are, and then we're now going to have to wait and see what's going to actually happen.
So there's been no educational meeting scheduled by the state to try to fill in the unknown when it comes to the legalization of cannabis at this point.
No, we've been having conversations amongst the health officers, and that's how we've been talking with the state, but nothing formally, convened by the state at this particular time now.
That's a shame because I think they have a responsibility to prepare us for this. And as you can tell, I'm very concerned about it. I just, just what we need. We have the opioid problems, we have cigarettes, alcohol, and now we are going to have cannabis. I mean, the message is not good to the public in regard to cannabis. It's just not a good message.
And I will say this to you, Councilman Koch, I'll just mention, and I'll say that you do recognize that not only is it going to be an issue within our communities, but it's going to really affect certain parts of our community more than others. So you know that our communities of color are going to probably be more affected by it. We recognize that when America gets a cold, people of color get pneumonia. Right? So we know that it's going to have a profound effect on our communities, but I am anticipating and expecting that our communities of color are going to have a tremendous detrimental effect when it comes to cannabis, just like with opioids and just like with alcohol and just like with tobacco. I mean, it's played over and over and over again for the past century.
When I was in the legislature, I had the honor to serve with Shirley Nathan Pulliam, who really spent most of her time. We were on the Health and Government Operations Committee in getting everyone to understand the problems in some of our minority communities when it comes to health and addiction. And so I do understand what you're saying. And, I think of our schools, I think of the communities. Hopefully it won't be as bad as I think it's going to be. I hope. And I feel good that you are where you are because I know that you're going to take action when action is necessary. And if there's anything that any of us can do on the council, please don't hesitate to contact us. Thank you.
Thank you.
Mr. Chairman.
Councilman Catch, thank Councilman Marks. Why don't we let Councilman Young go?
Sure.
I think Councilman Young had his hand up first. Councilman Young?
I think you're on mute.
Just wanted to ask, I know we did the local management boards together with the Department of Health. I was asking, we couldn't see the needs assessment online, if we could provide that, or if you could provide that to the council, the local management boards needs assessment.
So I didn't totally hear what you said.
Sure.
It was breaking up. You were breaking up.
The local management board's needs assessment, if you could provide that to the council, that would be most appreciated.
No problem. Don, are you on the line?
Yeah, we could do that very easily.
Okay. We'll
Appreciate
take care of that, Councilman.
I know we did them together. I just wanted to make sure we asked. Thank you.
Okay, Councilman Marks.
Thank you, Councilman Catch. You're 100% correct about marijuana use. As a teacher myself, it is amazing the impact that this has on pupils and will likely get worse. I, for one, intend to ask the school superintendent what he plans to do with regard to social media use and cell phones. There was a report that came out today from the American Psychological Association, which noted that teenagers are dealing with high rates of depression and anxiety and loneliness, and that social media and cell phone use may have an impact. So I just want to put that on everyone's radar. I think it's something we do need to ask the superintendent. I bring it up here just because of the public health aspect. Thank you.
Thank you, Councilman Marks. Thank Councilman Batoka.
Yes, thank you, Mr. Chair. Just a comment on the comments brought up by Councilman Catch and also by Councilman Marks to some degree. I know Dr. Branch indicated that the health officers are looking at the impact on local jurisdictions for the use of recreational marijuana. And so this is a high priority for the Maryland Association of Counties Legislative Committee to also monitor how we can respond, because each of the counties in Maryland and Baltimore City are all very concerned on how do we respond to all the collateral impact that we'll see with the legalization of recreational marijuana. So I think that there's a lot of eyes monitoring this. Everybody is ready to act once we have a better idea of how things play out. That's it. Thank you.
Thank you. Any additional questions or comments from the members? Let me just say that maybe I'm optimistic, coming from a person that don't smoke, don't drink, never tried marijuana. I'm optimistic and hopeful that maybe, just maybe, legalization of cannabis will, my thought process is most people, I am told most people who die from most people who die from fentanyl do not buy fentanyl. They are buying some other product and fentanyl is laced with it unbeknownst to them, like marijuana and other items. So I'm hopeful that maybe some silver lining in all of this is if it becomes legalized, maybe people will know what they're getting, and maybe some of the fentanyl deaths will, or fentanyl deaths will go down. Do you think there's any legitimacy in my thought process there, Dr. Branch?
We could always hope and pray, but to tell you the truth, the reality situation is that as it comes to the recreational use of marijuana, fasten your seatbelts. It's going to be a bumpy ride.
Okay. All right. Well,
Mr. Chairman, let me just say to you that my nephew works in the emergency room. He worked at Shepherd Pratt, and now he's at Harbor Hospital. And the thing that amazes me is if he has someone come in and, who bought, I don't know, aspirin or whatever on the street, and it's laced with fentanyl, and that particular person passes away, the interest that's out there in where did this person get this drug? Because so many people who are have a drug problem want that next high. And it just, if I saw somebody who died from something, I certainly wouldn't want I don't want it, but apparently that's not the situation in our community. And so, I mean, the drug issues, and I consider cannabis a drug, are very complicated. And, it's very difficult to get into the mind of someone who has the addiction, whether it be alcohol, cigarettes, or illegal drugs. So, yeah, as Dr. Branch said, we can hope and pray that what you're saying comes true, and that we're at least going to have a cannabis that is good, that it's not laced with anything, it's not bought on the street, and you don't know what you're buying. But I obviously I'm worried about it I've had students who were potheads. I don't know how else to say it. They were, and it's very sad situation. And so, but Dr. Branch, I'm going to task him with dealing with the problem.
So let me just say that one of the things that we do from a harm reduction perspective is we have what you call fentanyl test strips. Now, if somebody's buying an opioid like heroin, most likely it will always be laced with fentanyl, and we know that. So it doesn't really help in that case. However, we do ask people who are using other drugs like cocaine or marijuana to test their drugs with a fentanyl test kit, because then they would know if there was fentanyl in that drug, because they're not trying to get an opioid. They was trying to get marijuana, or they was trying to get cocaine. So one of the things that we try to do is from a harm reduction perspective, helping to save people's lives, is to tell people who are taking drugs that they should test their drug to make sure it doesn't have fentanyl in it.
Can you tell us what quantity of fentanyl can kill a person?
Well, I can tell you that that quantity is very, very small. If I had some of my slides with me, I can show you. I can tell you that it is grains of salt of the fentanyl, but we don't know how much fentanyl is in these drugs. And if a person is a novice to those opioids, it would be less fentanyl that would overwhelm them. So in actuality, we don't know how much it is, because it's going to be different for different people. But what's happening at this time now is there are people who had no intention of taking an opioid, none at all. They thought that they were taking cocaine, they thought they were taking marijuana, but they brought it off the street. And so they don't know exactly what's in it. And unfortunately, many of those things are now laced with the fentanyl.
It's stunning. It is stunning, and it's a real problem. Thank you very much.
Okay, any additional questions or comments? Well, again, Dr. Branch, we thank you so much for your presentation. We certainly appreciate the auditor's office and all of their work. And as always, we appreciate all your staff hard work. And if there's anyone up to the challenge to deal with whatever there is to come as a result of the legalization of cannabis, I'm sure you're prepared, Dr. Branch, and we're here as your co-stars, ready to help in any way we can.
All right.
I'm told that, like 100-some thousand people die every year of overdose, and 80% of them have fentanyl on board. So let's hope that something positive comes from what we're doing with the cannabis. I tend to agree with every comment that was made here today. I'm just trying to hope and pray. But there it is. Any additional questions, comments before we adjourn? Thank you, everyone. Have a great day.
Thank you. Thank you. Thank you very much.
Thank you, Mr. Chairman. Thank you, council members.
Thanks, everyone. Good night.
Thank you, Chair.